Hi, this presentation covers the aim statement, SWOT analysis, and the stakeholder plan for my proposed business project, MotherLink, a virtual postpartum support program for underserved mothers. The MotherLink initiative is designed to close the critical postpartum care gap for underserved populations. It provides a comprehensive nurse-led virtual support system that includes medical follow-ups, lactation consulting, and mental health screening. We will begin in Butler County, Ohio, delivering care directly into patients' home via secure telehealth. Our primary focus is Medicaid eligible mothers, particularly those facing logistical or economic barriers to follow up care. Over the course of 1 year, our goal is to reach 250 patients, reduce avoidable readmissions by at least 15%, and ensure 100% of participants are screened for postpartum depression. This is measured, achievable, and time-bound, aligned with the Institute of Healthcare Improvement and SMART guidelines. I anticipate questions like, is 250 mothers a stretch goal, or how will you track improvement? I will respond by showing how the caseload is realistic based on 2 full-time NPs and how our EHR will monitor patient outcomes and engagement in real time. The SWOT analysis represents a collaborative assessment from clinical, administrative, and technical perspectives, and it provides a comprehensive view of the internal and external forces that may impact the success of the MotherLink project. Our key strengths include the integrated nature of our services, combining medical, lactation, and mental health care into one seamless telehealth experience. This approach enhances continuity of care, and a likely question from the team might be, how do we ensure smooth coordination among disciplines in a virtual setting? And to address this, I have developed shared care pathways and integrated documentation within our EHR to promote real-time collaboration. For weaknesses, we recognize the limitations of virtual care, particularly when a physical exam is required. Anticipated concerns include, what's our process for escalating care to an in-person setting? I have established triage criteria for clinical escalation and will maintain referral partnerships with local providers. Opportunities are promising, especially as Medicaid increasingly supports telehealth reimbursement. Our team might suggest early payer engagement, which is already in motion through discussions with state agencies. Additionally, we are cultivating relationships with WIC, WIC, and local hospitals to streamline referrals and enhance reach. Threats include competition from established digital health platforms and the evolving landscape of telehealth regulations. Team members may ask, how do we differentiate from larger players like Maven Clinic? Our response will emphasize our unique value, a DNP-led, equity-driven model that centers on high-touch, individualized postpartum care tailored to vulnerable population. This is our edge. This stakeholder power interest grid was developed to strategically guide our engagement efforts and ensure we are allocating the right level of communication and involvement to each stakeholder group. In the high power, high interest quadrant, we identified the CNO, our project director, and Medicaid agency partners. These individuals and organizations are critical to our success and require consistent collaborative engagement. They will be involved in decision making, policy development, and early evaluation of outcomes. We have scheduled structured check-ins and shared KPIs dashboards to keep them informed and aligned. Stakeholders with high power but lower interest, such as legal and executive leadership, must be kept satisfied. Their support is essential for compliance, budget authorization, and long-term sustainability. We plan to provide concise, outcome-focused updates and ensure proactive risk management is in place. In the high interest lower power category, we have included our end users, the postpartum mothers, as well as OBGYNs and the women, infant, and children partners. While they may not drive policy, their engagement is vital to program relevance, trust, and effectiveness. We will use accessible communication, culturally responsive materials, and continuous feedback loops to keep them informed and involved. When the CNO requests a meeting to review these analyses, I will be able to clearly articulate our rationale for stakeholder placement. I will highlight that this framework ensures we are proactive, not reactive, in our engagement. It will also reinforce the value each group contributes, from decision-making power to on-the-ground insights. Ultimately, this approach builds alignment, accountability, and shared ownership of Mothers Link success. Thank you.